Hello everyone. It's finally so good to present in person, and it's so good not to say, can you hear me, can you see me through the screen. So my name is Jaspreet Kaur. I'm an MBA student at Concordia University. My teammate Salar Taki, biotech engineering student at Concordia, and Rene, computer science student at Concordia, are here to share our need identification journey that we did so far over the past few weeks. So our need statement is, it is a better way to detect the roadmap in the abdomen to reach the tumor organ undergoing an operation for laparoscopic surgeons to improve the surgeon's ease of use and clinical outcome. And this idea is inspired by from the Dr. Fields interview that we did in November. After weeks of brainstorming, each one of us came with 10 needs each. So out of those 30, we selected the top 12 on which we do the assessment criteria run. And our assessment criteria are 5 criteria, beginning with team skills, our understanding about the disease, and our technical and business skills, access to resources, the medical ecosystem, reach to the subject experts, and the estimated market size, the competition, growth rate, demand and supply, followed by the ease of prototype testing, how easy it is to develop a prototype for that kind of need problem, and the need type itself, whether it's a blue sky or incremental innovation. Yeah, and these are the rating scales for these needs. As you can see, for access to resources team skills, it is ranked from 1 to 5, depending on very high to very low, followed by the market size. Anything less than 1 million, we kept it at a score of 1. Anything above than 7 million was at a score of 5. So after that, we have our need scoring table. And out of these 12 needs that we showed in the slide number 2, we have the top 3. And then we did run scope up and down on those needs to eventually arrive at our final need. In our need statement, the problem is to detect the roadmap in the abdomen to reach the tissue or organ undergoing an operation, and our outcome is improve the surgeon's ease of use and clinical outcome, and the population is laparoscopic surgeons for this need statement. So if you look at the market size, there are annually 40 million laparoscopic procedures performed throughout the world. Out of that, 1/3 is US market, that is 1.5 million procedures per year. And to add on the size of the laparoscopic devices market, that's $13 billion annually, and the expected growth rate is 5.8%. With this, I pass on to my teammate Salar.
Thank you, Jaspreet. Now I want to have a quick review of laparoscopic surgery. As you know, laparoscopy or minimally invasive surgery is an operation performed in the abdomen or pelvis using small incisions with the aid of a camera. To start the operation, the surgeon first makes several small cuts to entry, then a tube through each opening is inserted, and the camera and surgical instruments go through those. Then the surgeon starts the operation. On the other hand, the surgeon might also perform certain imaging tests, including ultrasound, CT, or MRI, before the operation. These tests can help the surgeon better understand the abnormality being examined during laparoscopy. It will also allow the surgeon to find a roadmap of the inside of your abdomen, which helps him how to reach the organ to be operated on. This can improve the effectiveness of laparoscopy to a great extent. Unlike open surgery, in laparoscopy there is no direct visual contact with the organs, where surgeons use an endoscopy camera which captures and feeds operating theater images onto a display, as shown in image A. Also, according to image C, the surgeon needs to look continuously at medical images taken prior to surgery, and then he makes a decision on how to reach the organ or tumor that undergoes the operation very quickly. In image B, you can see that an important issue is hand-eye coordination. As surgeon must look at screens placed outside the field of operation, this originates discomfort, affecting the surgeon's efficiency due to a disconnect between the visual and motor axis, because they cannot look at the instruments or their hands and the video image feed simultaneously. Surgeon discomfort and fatigue caused by looking at the display and a negatoscope positioned outside the surgeon's visual field, made worse by the length of the procedure. The fatigue is especially felt on the surgeon's neck, as it is strained from adopting unnatural posture in order to visualize the laparoscopic visual field. In this project, there are two main problems. The first one is there is no computer-based road mapping. Currently, road mapping for reaching the target is based on the surgeon's memory, skill, or assumption. And the second problem is surgeon mistakes, because screens placed outside the field of operation lead to surgeon's fatigue and discomfort, leading to mistakes that may cause damage to the body organs. Now my teammate Rehana continues the presentation with a possible solution.
Some similar works have been done before, for example, especially in simulation area like a CT-guided needle biopsy. But on the other hand, as always, neurosurgeons are pioneer, and we can see some neurosurgeons that use similar ideas. We separated our features into two groups, must-have and nice-to-have. Let's start with must-have features. The first and foremost important feature is getting suggestion to the surgeons to reach the point and their target in an optimal way. And the second feature is that display pre-operative modalities like CT scan and MRIs reflected on laparoscopic movies simultaneously. And the last one is clear display of tumors in the exact place. On the other hand, we have some nice-to-have features that we are going to implement in our future work. The first one is recommendation of best point of entry and incision in order to have the minimal damage into our blood vessels and nerves. And on the other hand, not only we are going to show the wound tumor to the surgeon, but also we want to segment the wound tumors into core part and enhancing potential show it to the surgeons. All these things leads to improve patient safety, reduce human mistake, and improve accuracy and reduce the operation time. Our stakeholders are surgeons, hospital, patients, medical device companies, and regulators. We thought about the implementation a little, and we decided to implement this idea with augmented reality and HoloLens. For people who don't know what is augmented reality is a technology that combines real and virtual world with each other in a real-time interaction. And all the objects that reside in an environment can improve by some features that gathered by some sensory modalities. And during surgeries, surgeons will see through headset like HoloLens that you can see in the second image, and they can see different modalities like CT scan and MRIs and all the features that are extracted from them, like our bones and soft tissues on the patient's body in a way that they perceive them as a natural environment. Thank you.
Yeah, I think we're done.
Thank you. So now the questions.
So what are all your needs in the area of minimally invasive surgery?
Yes.
What?
Sorry?
What?
It's in the laparoscopic surgery, minimal invasive surgery.
Yeah.
So all your needs are in that area.
Oh, the set of selection? No, the needs, we can go back to the slide one. So some of them were from the simulation side, and other were from the laparoscopic, and some were focused on the child patients, improving the experience. And other than that, we had some of the needs that were related to the plastic surgery. So, but like we thought our team skills don't match to solving those problems. So we focus on something that's a kind of overlap of technology and some of the medical biotech knowledge that we have with Salar and with REPM.
Okay, what's the red and the green and the blue and the black?
Yeah, they explain the problem, outcome, and population. And the problem is in red.
Yeah.
Yeah, the population is in blue, and the outcome is in green for
Okay.
all of them.
Yeah. So you mentioned you wanted to segment the tumors, right? That was one
The
of your
first
nice
problem
to have.
that is a must nice to have feature. We want to segment the tumor.
So tell
And
us-
the must-have features
tell
is
us, tell us why that's nice to have.
Yes, we do. Yes.
I need to see a picture of it.
Why it is nice to have I think,
Yeah. Our first idea was the base point for entry and the place of incisions on the abdomen, but we thought that it's not a good one because yeah, it's not a good problem because so many surgeons know where to entry, and so we decided to have the problem with road mapping because the surgeon wants to reach to the tumor or organ inside the body, for example, part of the liver, but he doesn't know where exactly it's placed. So we want to design some procedure, write road mapping, and tell the surgeon where exactly go and reach to the exact point of surgery.
Okay.
Dr. Fred mentioned about this problem in the interview we had with him last month, and if you want, we could play the part of.
No, so I'm asking you to explain it. Why still don't understand. Still don't understand. Anyway, thanks.
One last question. Yes, Edna?
Can you, I'm not familiar with this problem, I'm quite familiar with that. Can you quantify sort of the size of the problem?
The size of the problem, it's something.
In how many operations? One issue I think is that you're not differentiating maybe between training of a novice and maybe a trained laparoscopy surgeon. But I'd be curious to know how many of trained surgeons have that problem and how often does it happen?
We haven't analyzed that, but it's something that has a good future because you know the exact place of tumor in X, Y, Z. And it's important because the surgeon during the surgery look at the CT images and the laparoscopy video and go to the tumor and will want to do something, tumorectomy, for example. He doesn't know the exact size of the tumor and the surroundings, but this method could help him to understand.
Yeah, but size doesn't have to do with navigation to the tumor. So these are two different.
Not the sizes include this method. The finding the best way to reach the tumor, and at that place we have the exact size of the tumor.